current challenges in the management of early colorectal cancer, in stage 2 colorectal cancer, you ask the question, adjuvant chemotherapy, should we do? And if so, whom to do? And we are treating so many patients to save only a few patients. And in stage 3 colorectal cancer, there are questions like whether we'll treat them for 3 months or 6 months. And in patients in whom we put on surveillance, when will be the patient recur and can we detect these recurrences early? So these are all the questions. So that's the context in which we are going to look at the role of minimal residual disease. And then we're first going to look at the methods to detect the minimal residual disease. And then how do we apply them in the clinical setting? We look at Guardant Reveal. Guardant Reveal, why it is important? Because liquid biopsy is useful to detect ctDNA, fine, but it is just like finding a needle in the haystack, because the percentage of ctDNA that is present is very, very low percent in most of the patients. That's when Guardant Reveal is a very innovative idea. It's kind of first test for detection of minimal residual disease, and it does not require the tumor tissue. And this assay, in a novel way, is trying to combine both genomic alterations and epigenomic signatures. What do we mean by that? Genomic signature is the classical detection of the SNV single nucleotide variations and in-frame deletions, indels. That's what most of the tests would do. But epigenomic signatures are the methylation part. And then you combine both genomic alterations and epigenomic signatures, and that's what is the signature idea of Guardant Reveal. And this really improves the sensitivity to detect the ctDNA. We know that ctDNA is found there, but abnormal DNA methylation is more common in colorectal cancer, and it provides more signals to detect the ctDNA. For example, this is the KRAS G12C being detected by conventional method, but the moment you use the methylation, it's kind of amplification that you are able to detect it more easily. That's the whole idea of this methylation biomarkers. The other advantages are that there is more abundant mutations to detect, and it is also highly disease specific, highly tissue specific. So it becomes a very robust marker method to detect. Guardant Reveal interrogates both genomic and epigenomic signals and gives a result as either ctDNA detected or ctDNA not detected. So it helps you to optimize your treatment. I conclude that detection of ctDNA by Guardant Reveal is a revolutionary technology to detect the minimal residual disease